My name is Sierra Ashton, and this is a behaviorist biography presentation on Peter Gerhardt for EDSE 619 at George Mason University. Who is Peter Gerhardt, you may ask? Peter Gerhardt is an expert in the field of applied behavior analysis with over 35 years of experience. He has served as the president for the Organization for Autism Research and is currently the executive director of the EPIC School located in New Jersey. Contribution to literature. Peter Gerhardt has been featured in multiple books, but for the sake of this presentation, I will be discussing his contributions in two. Gerhardt's assessment of social competence in learners with ASD appears in Chapter 13 of Practitioner's Guide to Empirically Based Measures of Social Skills. Within this chapter, Gerhardt and his colleague Mayville discuss the social deficits that appear within autism spectrum disorder, such as joint attention, reciprocal social interaction, social competence, and survival. We typically use and need these skills every day. Gerhardt discusses that when addressing the social competency of an individual with ASD, we are aware that there are deficits, but they are not accurately being measured. Within this chapter, Gerhardt provides a list of different measurements that can accurately portray where the individual is in terms of social skills. If we can accurately assess where these individuals are, then we can provide them with the appropriate intervention to enhance their social skills, making it easier for individuals with ASD to be accepted into the workforce as well as the community. Gerhardt has also been featured in Chapter 6, Adolescents and Adults with Autism Spectrum Disorders, Employment, and Related Services for Adults with Autism Spectrum Disorder. Within this chapter, Gerhardt and colleagues discuss the misconception about individuals with ASD not being capable of entering the workforce. Gerhardt exposes the systems in place to assist individuals with ASD in transitional services to prepare them for post-secondary options. In reality, these services are in place, but they are not fulfilling the expectations, leaving individuals with ASD unprepared even though the transitional services in place are individualized and tailored to the needs of that individual. Effective interventions for individuals with ASD. Gerhardt is an advocate for the capabilities of individuals with autism spectrum disorder. He often discusses the needs of better support for these individuals. The interventions in place have demonstrated that they are not effectively being practiced or followed due to the results of large numbers of individuals with ASD lacking in social skills and being underemployed and unemployed. There are also not enough staff to work with individuals with ASD as there is a high turnover rate. The staff are usually not properly trained, leaving individuals with ASD in a vicious cycle of underemployment and not being able to receive the proper treatment. Transitional services are to be in place for individuals receiving special education services before the age of 16 in order to prepare them for post-secondary options and related services. Many have become ineffective. Gerhardt and Lehner, 2010, believe that transitional services and related services can be effective if the systems in place follow the protocol of Individuals with Disabilities Education Act of 2004. Gerhardt also believes that ABA is effective as much as the research in working with the autistic population uses this. The concern is that it isn't being applied correctly, and there is also a limited amount of research regarding the evidence-based practices, making it hard to provide other intervention options. Two intervention options that Gerhardt has specifically provided research on have been proven to be effective is aversive intervention and non-contingent reinforcement. Gerhardt et al., 1991, in Social Policy on the Use of Aversive Intervention, Empirical, Ethical, and Legal Consideration, rebuttals the idea that aversive intervention should not be used due to the empirical, ethical, and legal concerns. This is a very controversial topic, but Gerhardt stands firm in his belief that aversive intervention is appropriate if it is used correctly. He takes into account safety, application, and consent to ensure the effectiveness of this intervention. Gerhardt also shares his research on Richard, an 18-year-old male who had been kicked out of many programs in treatment of severe aggression in an adolescent with autism, in which he uses non-contingent reinforcement in addition to communication training. This article sheds light on how important effective training is, as Richard was kicked out of multiple programs due to the severity of his behavior. To demonstrate the effectiveness of non-contingent reinforcement, staff were paired with the reinforcing item, which was food, and he was also taught communication skills, such as raising his hand when he did not want to be bothered, and to replace the aggression. The study indicated that using non-contingent reinforcement and communication training was effective in extinguishing aggressive behavior. Paving the way for individuals with ASD. Gerhardt's work is important to the field of applied behavior analysis because it holds the systems accountable that are in charge of providing services to individuals with ASD, such as special education. Although the diagnosis of autism is expensive, they should not be at a disadvantage because of it. Gerhardt raises concern about the following guidelines in IDEA for transitional services. He also advocates for the proper implementation of adaptive and communication skills so that individuals with ASD are able to become independent as well as join the workforce. Based upon Gerhardt's research, if we work with these individuals at a foundational level, meeting them where they are, and providing effective treatments and interventions provided by competent and well-trained staff, then these individuals will be able to demonstrate their capabilities. Treatments using applied behavior analysis, such as non-contingent reinforcement and aversive interventions, have been proven to demonstrate the capabilities that Gerhardt has mentioned. Gerhardt's efforts in addressing the needs of these individuals are also important in the destigmatization of individuals with ASD. Interview. The following questions are what I have composed to ask Gerhardt. I chose to ask these questions because I noticed that he does not talk much about diversity in his findings. I also wanted to discuss where he sees the future for ASD headed in regard to academic efficacy. Question number 1. Being that you work with adolescents with autism and you are in favor of aversive interventions, do you think that using this type of technique is appropriate for this age group, even considering how it is used? Number 2. What are the statistics based upon race and socioeconomic status regarding the successful transition programs? Does this affect the majority of individuals with ASD despite their socioeconomic status? Question 3. As you advocate, transition planning is mandated by IDEA and is to begin before the individual turns 16. How do we hold the schools responsible for the time that they must prepare these individuals and the outcomes? Is there any hope for the future to be able to show documented attempts based upon transition plans? And if it is unsuccessful transition has occurred, that the plans can be remodified although the individual is no longer in school? Here I have included my references that I have used without my behaviorist biography. Thank you.